I know most of the people in our country are smoker, but they all have a very common question that I smoke 10 years back, but I don't have any problem. So why you are talking me that I am going to face a lung cancer? Why?
Nobody will agree that they will actually fall sick. See, everybody thinks that they are superhero. Yeah, they are always immune. Nothing will happen to them. You know, smoking about 10 years, you won't see the effect now. You give it yourself another 10 years. Give the time for the cancer cells to mutate. And probably by the time you reach 50s, 60s, then you will see changes in the lung. Okay, you can see tumors growing. You know, so lung cancer doesn't develop over days. It actually develops over the years.
It can be happen anytime.
Yeah, it will happen. It's like a time bomb in smokers.
Okay, then I want to go to the very important topic, that is impact of smoking cessation before resection of lung cancer.
Yes.
What do you think?
So we always emphasize every lung cancer patients who are smokers to stop smoking, if it's possible, at least 1.5 months before we actually do the surgery. But some smokers are very adamant. It's not easy to tell them.
About
they might even smoke 1 day before the surgery.
Okay.
So we can't do anything much. So that happens in Malaysia quite common. Even when I was actually working in Liverpool, the patients are going for lung cancer surgery today. They will even smoke until 1 day before the surgery.
Okay.
So the thing is, the importance of stopping smoking is so that your cilia that have in your airway can regenerate, so that you can actually push out all the phlegms. Otherwise, you produce a lot of phlegms after the surgery, and you will basically drown.
Post-operative complication can arise, right?
Yes, yes. You can get lung infections because you cannot actually bring out the phlegm. So that is the importance of actually stop smoking. If possible, at least minimum 2 weeks.
Why do never smokers get lung cancer?
That's a very good question and a very confusing topic.
Okay.
All right. Smokers getting lung cancer, there is a good reason. Now, never smoker getting lung cancer is actually very sad.
Okay.
Now, never smokers getting lung cancer is actually a different clinical entity. You know, there is, you can say maybe there is a bit of smoking going in from secondary smoking. You got a bit of pollution going in. But the main entity in never smokers are actually genetic problems. You have genetic mutation in certain genes in your body, which is getting mutated, causing lung cancers. So there's a lot of genes in our body. For example, we call it EGFR. It's epithelial growth factor receptors.
Can it be genetic or
mostly a genetic
like
mutation problem.
Fast blood, if the fast blood person have the lung cancer, then
you can have that, but sometimes you can have skip generations. You might not get immediate, but you can have 1 generation skipped. Yeah, so it's definitely related to genetic problems. It's about 20% people who are never smokers get lung cancers. It's actually quite alarming as well. Smokers get another cell type called squamous cell. So it's 2 different types of cells in smokers and in never smokers. So the treatment difference.